Welcome back. We're here now talking with Phyllis Salowe Kaye, who is the Chief Executive Officer of Citizen Action, which is a nonprofit community institution, I might add, and has been very involved in developing ways in which we can build the capacity to understand what is really going on in our communities and how it affects the way in which we are able to improve our communities. Phyllis is really happy about another opportunity to have to engage our communication research in terms of outreach and developing the opportunities so that people in our community know what type of programs are really actively involved. You know, we hear a lot about nonprofits as if they are not really being effective, but in many cases nonprofits have certain priorities, and in the priorities that they have conditionally, they're not always hands-on in the community. Your program specifically involves what affects our communities, and we're very happy to have you here today.
Good. Happy to be here.
Well, now, we know that there have been a number of different activities going on that your organization focuses on predominantly. Would you do me a favor and give us an overview again of what Citizen Action really is all about?
Sure. We're a 31-year-old nonprofit statewide organization. We have offices in 7 parts of the state, starting in Passaic and going down to Cherry Hill. We are a membership organization. We have over 60,000 families that join and pay dues when one of our door-to-door canvassers knocks on their door and says, "Hi, we're from Citizen Action. We're here about lowering your utility rates," and then we talk to them about our campaign, and then they join. We also have 120 organizations that are affiliated with us: senior groups, community groups, labor, environmental, religious, civil rights. So we're both a membership organization and a coalition organization. We provide direct services to people so that we just completed this year's tax season, and we did free income tax returns for almost 5,000 people. We provide first-time homebuyer counseling, and unfortunately, we're the state's largest HUD-certified loss mitigation counseling agency, where we deal with people who are losing their homes due to foreclosure. We have a healthcare hotline, and I know that the mayor has made a big commitment to providing people with information about healthcare, a wide range of healthcare. We have a hotline that works 24 hours a day to answer people's questions, and healthcare is actually one of the primary issues that we're working on that I'll talk about in a bit. So we've been here for 31 years. We're a nonprofit. We do both direct services, and we also do policy development. We're a lobbying organization. We have a staff of lobbyists that go to Trenton or Washington to work on issues that are important for, in particular, low and moderate income families, issues that deal with pocketbook issues. Our mission is to try and balance the power between the major corporations that often only care about their own tax breaks and the average person who is fighting right now in this economy just to keep their head above water. And that's our base. That's who we represent.
And advocating for individuals that certainly need to know what type of ways in which they can navigate the systems and learn what are the values in relationship to having such a valuable organization that is really very well informed. One of the things that I did want to hear more about was the purpose. Why did Citizen Action really get started?
We got started 31 years ago when I guess at that time some labor unions and the New Jersey Council of Churches came together and said, look, we have a bunch of organizations that are out there. They're doing their own special interest work. So the New Jersey Tenants Organization fights for tenants' rights. Labor unions work on workers' rights issues. Environmental groups work on clean air and good water. What we really need is one organization that will be a coalition of organizations that can work together. So it was decided that what was needed was one organization that brought together a lot of organizations and figured out what issues folks could agree upon and how the different organizations who were single issue organizations could help each other move forward on getting legislation and regulations passed that would benefit everybody. So it was really citizen action was a bringing together of all the individual strengths of individual single issue organizations and having them work in one organization on issues in which they could agree. There are still going to be issues that each organization takes on. And then what Citizen Action brought to it that was the addition was the 60,000 families who actually joined, and they were our feet on the ground. They were the people that we could mobilize. So besides the members of the individual organizations, they were real citizens that we worked with, who cared about some of our issues. They didn't care about all of our issues, but we were able, and we are now very able to identify which member cares about which issue, because in these computer times, we're able to know who opens up what email and who writes the letter to what assemblyman or senator or congressperson about what issue.
And it creates a vast way in which you can communicate with people. And the logic behind it, identifying to them in your membership process, is it really a capacity of only a few different municipalities, or are you statewide? Or
well, we're a statewide organization. We have offices in Patterson, Newark, Rahway, Cherry Hill, Plainfield, a variety, Highland Park. We have offices, which mean that the people who need the direct services can come into those offices. Somebody in Irvington who wanted to get their taxes done for free and needed an office that was open 7 days a week during tax season could come to the Newark storefront that we open up for tax season and get their taxes done. Our services are available to anybody, the direct services throughout the state. We obviously, the mayor of Irvington, who sits on our board, Mayor Smith, is very much aware of the issues and the work that we do. So if he becomes aware of something, for example, on healthcare, which I know is a big issue. One of our victories in March of this year was that we convinced Governor Christie to expand Medicaid to cover an additional 300,000 people in New Jersey who are now going to be eligible for Medicaid. It's really important, and that didn't exist before. And he was not going to do it. He needed to be pushed to do it. We pushed him with our 60,000 members. Now, the mayor of Irvington has the ability to reach out to potential people in Irvington and tell them, you're now going to be eligible for Medicaid. As the Affordable Care Act, which is known as Obamacare to some people, as it becomes implemented, folks are going to have a very, very short period of time to enroll in the exchanges which are being established. Now, the governor chose to do a federal exchange rather than a local exchange. That means that the healthcare exchanges where people are going to get to find out if they're eligible for subsidies and decide about the kind of health care policy that they want, they're only going to be able to enroll in these between October and January, very short period of time, and then it's closed off until the following year. So the mayor of Irvington, or whatever municipality, it could be the mayor of Maplewood, who also sits on our board, and even mayors who don't sit on our board, because we're doing all this outreach to let folks who are in a position, who have constituents, whether it's a pastor, a mayor, the head of an organization, the head of whoever, a community-based organization, to know, hey folks, if you don't have health care, or if your health care is too expensive, you have this ability from October to January to get on board and sign up. And they're actually going to be navigators who help people through the process of selecting what policy works best for them. And we're looking for ambassadors who we will train, who will be volunteers, who will help us get the word out to all of those people in New Jersey who don't have health care or who are finding their health care policies unaffordable, whether it's an individual or whether it's a business that's providing health care to their workers. There are going to be navigators, and we're going to be training the ambassadors. So we're trying to make this small window a time of opportunity for both the residents of Irvington and every other place in the state who would be eligible for this program. We fought really, really hard to get Obamacare passed, and it's great. There's a lot of things in the legislation that people know about, like it doesn't, now pre-existing conditions don't count. Now college kids are going to be able to be covered under their parents' policies. There's a lot of good stuff in that bill. The most important part of the bill is the implementation, which will start in October when the state exchange is going to get set up, and people are going to have to go through it to pick their provider. And we are not going to leave it to the state of New Jersey to do the outreach to get people to come and enroll. It's going to be up to Citizen Action and our partners like Mayor Smith or AARP or a church to let their people know that, hey guys, you got this period, you got to come in, you got to walk through the process with someone, we'll help you do it, and we can do it on the phone with you, and you got to sign, or you can do it in person. However it's done, you got a short time, and you want to jump in there and take advantage.
Now, I think you said, what is it, a 90-day period that we're going to have in terms of the enrollment?
I guess it's October, it's January. It's just like when, you get on somebody's health care policy, you can't make change. Unfortunately, that's the way.
One of the things that it seems like, and a lot of us still are not clear as to who needs to be eligible or who really needs to be applying to these kinds of programs. And this in particular is one that's going to be so important because there are penalties that are going to be involved for individuals who don't apply for the health care coverage. The aspects of it, the planning in relationship to coming up with the concepts of making sure that people know how to be aware, and the building of the facilities that are going to be part of the outreach effort, has that begun yet? Yes,
we are working with scores of organizations. We are applying for money because it's going to be very competitive. We need funds to do the outreach. Obviously, if we don't get the money, we're still going to try and get the word out. But if you're funded, you have much more. You have an ability to reach a lot more people. So we are working through a statewide coalition called Healthcare for New Jersey, which we put together. That is a wide range, has a wide range of organizations, and there's going to be other groups putting together similar types of groups. So the more people that are out there telling people, we're going to have the training program. So it has to be sort of a multiplying effect. There will be navigators. The navigators are the people that an individual would sit with to walk through the process. But then there's the ambassadors, who are the volunteers who are out there getting the people to go to the navigator, because if you don't know that there's a navigator, you're never going to get there, and you're not going to apply, and you're going to miss out. And yes, there are penalties.
Now, again, I just want to touch base with the idea of membership with Citizen Action. The idea of people who would like to be a member, do they have to have certain skills?
Anybody, first of all, we have a website. It's www.njcitizenaction.org. Folks can go to our website. There's a lot. You can do everything on that website, for sign up for foreclosure counseling, to first-time home buyer, to joining the organization. People, once they join, and we have a special kind of a member, which is a member by affirmation, so that if you actually don't want to make a contribution to join the organization, you can have a free membership for a year, and you'll get all of our information through email or through hard mail. You'll find out about the programs and the events that we are doing. And anybody can join for at least $5. That's the minimum contribution. We have events, for example, the first Friday in October, we're going to be holding a foreclosure. It's the fourth foreclosure summit at NJIT in New Jersey, where we will be bringing in people from all over the country to talk about financial reform, how the Dodd-Frank bill affects them, where we are with the AG's settlement, and also to talk about how we can win principal write-downs for folks so that the principal of their mortgage gets written down and forgiven, which is really the only way that many people are going to be able to remain in their homes. So if a person joins at our website, they will get regular information about that. They will also get action alerts. So for example, we are working to, next week a bill is going to get introduced that would provide earned sick days for every worker in New Jersey. Right now, over 1 million workers go to work every single day, and they do not get paid when they have to take a sick day. And so we want to make sure that all workers, first of all, we don't want workers coming to work sick, especially restaurant workers who serve you your food. I mean, don't sneeze in my linguine. I don't want to catch what you have. So we will be sending out action alerts to folks, telling their legislators to become co-signers of those bills. New York, this week New York City passed an earned sick day bill, and we believe that New Jersey this week will have one that is introduced, and it's going to take a while to get passed, but if you're a member, we'll keep you up to date on the earned sick day bill. You'll have an opportunity to reach out to your local legislators asking them to be a sponsor of the bill. You'll know if there's a meeting with a local legislator that you might want to come to, telling them why it's important to you. We need people's stories. We need to find out workers who don't have paid sick days, and they should contact us. They should reach out to us. We need to be able to show how this bill is needed.
That's excellent. And I'm very happy about the opportunity that as a organization that we can participate and support your efforts as well as you support what we're doing here in the township for the mayor. And we want to look forward to being a part of the mission. You have been so effective in many of the things that you have been doing in the community, and our effort to be supportive to it is really important. We thank you very much for sharing with us the information, and we'll be looking forward to ensuring, especially during our Health and Wellness Day in Irvington next week. I know that the Healthcare of New Jersey group will be out distributing information and will also be a part of our healthcare symposium. So we're going to be doing whatever we can to now get on the ground running, letting people know how important it is to get involved and know when the right time it is to sign up for our healthcare coverage, and also be a part of the mission to ensure that workers get the kind of benefits that they need when it comes to sick days. Thank you very much for coming.
Okay, and we really appreciate the mayor's support and participation in our organization. So thank you for having me.
Thank you very much. And thank you for tuning in.